Hello, my name is Virginia Daniel Tyree. I am from North Carolina and I currently live in Portland, Oregon. I am taking post-baccalaureate classes in speech therapy at Portland State University. I originally made this video for my speech disorders class at PSU because I wanted to give them a personal perspective on what it's like being an adult who goes to speech therapy 3 times per week. I have a tongue thrust disorder. This is one of the reasons why I'm going to speech therapy. Tongue thrust is also called an orofacial myofunctional disorder. Essentially, when I swallow, my tongue pushes against my teeth. So my tongue uses a forward pushing motion to swallow instead of tracing along my alveolar ridge and soft palate, which is how a normal swallow usually happens. Tongue thrust is also called an immature swallow, or a reverse swallow. This reverse swallow is an important motion for infants as it allows them to latch onto a nipple or bottle and thus get the liquid sustenance that they need for development. However, as babies become ready to transition to solid food, the swallowing changes in order to facilitate moving the food effectively towards the throat. I never made that transition in my swallowing pattern. I don't know why, but it is causing problems. One of the first problems is that this swallowing pattern has resulted in an open bite. Our tongues are very powerful muscles. The constant pressure that my tongue is exerting on my teeth over and over again is causing them to move outward. This is not a picture of my teeth, but my bite looks very similar to this. It's not just a problem with aesthetics. This is actually causing a problem with my ability to eat. It is very hard for me to bite through my food, and this is only going to get worse as I continue to age if I don't fix my tongue thrust swallowing pattern. One of the ways I am trying to repair my bite is with lingual braces. Now, I had traditional braces for years in middle school, but because I still swallow the same way, my tongue has slowly but surely pushed my teeth out. Again. I decided to get lingual braces this time around. Lingual braces are great because they are practically invisible since they are on the inside of your teeth. Some drawbacks to lingual braces are that they are very few orthodontists who are certified in these techniques. They're more expensive than traditional braces and they can be quite painful. This pain is actually one of the ways that they are useful for my particular tongue thrust disorder, because when I swallow and my tongue pushes against my brackets on my teeth, it is a not so subtle reminder that I am swallowing the old, incorrect way. This is helping me to retrain my tongue to a new swallowing pattern. It's going pretty well so far. My orthodontist also wants to install a fixed palatal crib, also known as a tongue crib, inside of my mouth. This is basically an appliance that will restrict the area inside of my mouth so that my tongue will be forced to use the weak muscles that I usually don't use, and it will be forced to come up with a new movement and new resting patterns. I have rescheduled and delayed this appointment like 3 times because I'm scared. I am really not looking forward to this. I know theoretically this will be good for me in the long run, but for now I'm feeling pretty claustrophobic about having another chunk of metal inside of my mouth. My mouth is already on the small side, and it is starting to feel pretty crowded in here. I'm sure you've noticed by now that I also have a lisp. I've had it all of my life. It used to be much worse when I was young, but it is definitely still noticeable. I was reading a book by one of my favorite authors, Me Talk Pretty One Day, by David Sedaris. It's about him growing up with a lisp and how he went to great lengths to avoid saying certain words or avoid being in certain situations where he would have to say those embarrassing sounds. Wow, it was like a light went on in my head. I realized I do the exact same thing. I also had learned how to avoid certain words and phrases. For example, here's a typical conversation. Oh, you want me to come and meet your new puppy? Yes, of course. Oops, yep, no problem. I'll be there soon. Oops, I'll be there right quick. I would even try to influence what my friend would name the puppy so that I could be able to say it without embarrassment. Don't you dare name your dog Sassafras. I thought you cared about me. I know it sounds silly, but it's true. I've also gotten to be pretty good at distraction. I learned that there is no way I can avoid saying certain sounds, then it is less embarrassing if I talk with my hands or talk really quickly or look away when I have to say the S or dance or all kinds of things. This is actually the reason that I made this animated video in the first place, because it helped me get through giving a presentation in front of my class. and I knew they'd be distracted with avatars instead of staring directly at me while I was talking. Here's another example. There's this cute guy. Well, pretty cute, right? Uh-oh, Seth? Oh no. Well, maybe it'll be okay. I'll just call him Boo or Hun or something. Yeah, we can do this. Totally make it work. And then I realized, wait, this means I have to be Seth's girlfriend? Nope. Too bad. Sorry. Bye. Ooh, who is that? Teo Tyree? I like it. I like everything about it, especially his name. There's not an S anywhere. We fell in love. He asked me to marry him. I took his name. Virginia Daniel was my old name, which was perfect because I could say it, but Virginia Tyree is great. That works well too. We can have little Teo Tyree Juniors and little Jenny Tyree Juniors, and I won't have to be embarrassed saying any of our names ever, ever, ever. Yep, I was very, very happy about this. So Teo started noticing that all of my favorite foods happen to be soft and mushy. Indian food or soft Thai noodles, and I never wanted to eat pizza or sandwiches, especially in public. He realized it's because I had trouble biting through the bread. I would actually even rip up my food into lots of tiny pieces just so that I was able to eat them. I hated eating in public because I felt gross, and I had never actually put it together why. Even around our close friends and friends I've known for my whole life, I would still get anxiety if we were going to go eat somewhere that would be difficult for me to eat. I finally decided to go get help for my teeth, and it hit me. Oh yeah, speech therapy. It can help me with both of my problems, my eating trouble and my talking trouble. This is going to be fantastic. I can't wait. I found a wonderful clinic in downtown Portland called the Parkwood Clinic. They're awesome. I see 3 different speech therapists 3 times a week in small 15-minute intervals. I learn different techniques from all of them, and they collaborate to help me. For instance, Ashley Rose. Of course her name is Ashley Rose, right? It will really help me with my swallowing, and then she'll collaborate with Keegan about ways that we can make modifications when it just gets too hard, and we all work as a team. I feel really lucky to have found them, and I highly recommend them. I want to give you examples of what we actually do in clinic. First, we do swallowing and oral motor exercises. I have to chew up food and make a bolus, which is a cohesive food ball, stick my tongue out and show it to the therapist. At first, I found this to be humiliating, but Ashley is a very good sport because she will actually eat and stick her tongue out too. Then we practice my new swallow. I trace my tongue along the ridge of my mouth in order to transport the bolus to the back of my throat. And the first few times were horrible. I felt like I was going to choke, but I've got the hang of it now. It really is still difficult to remember to use my new way of swallowing. I'm 35 years old. Trying to change the way I swallow is incredibly difficult. It feels like somebody is asking me to change the way I blink. It's just so hard to change this pattern. Okay, next we do sip slurps. This is where I take a tiny sip of water, cup it in my tongue against my alveolar ridge, and keep it from spilling out. Then I push the water down my throat without closing my mouth or tongue thrusting. This is hard for me, but it's getting easier. Next, we do speech therapy. We start with just the S sound in isolation. Then we move to initial S words and one-syllable words in blends like see, sell, and sleep. These are CV and CVC configurations, very basic to begin with. Then we move to medial S words with complex word structures. 2-syllable words such as messy, pencil, blossom. I repeat my words while Ashley grades me, and as you can hear, I'm not perfect at them yet. I have good days and I have bad days. Once I reach a certain percentage of correct reproductions, then we move on to a new skill set. Okay, so it is obvious that I have a problem with my S sounds, but I also have a problem with my Z sound. The tongue needs to be in the same position, approaching the alveolar ridge, in order to produce the S sound and the Z sound. The only difference is that the S is not voiced, and the Z is voiced, which means that the vocal folds vibrate. We repeat the exercises using Z sounds in the words instead of S sounds. Next, we move on to phrases and sentences. For these, we use high-frequency words and phrases. These are phrases I encountered frequently in my everyday life. We add carrier phrases, which is a way to transform the words and names into natural sentences. Here's some examples. This is Allison, my personal trainer. I see my hair stylist caprice. I stream Stella's music. Scott Schneider loves ice cream. I eat pizza with Ms. De La Cruz. So I was getting the hang of speech therapy and then Ashley dropped a bomb. She told me I was making such good progress with my S and Z sounds that now we could start working on my T sounds as well. What? What do you mean I have trouble with T sounds? My husband's name is Teo Tyree. My name is Virginia Tyree. You mean I can't say my husband's name correctly? I can't even say my own name correctly? I was devastated. I lost it. I started sobbing. I had thought T was a safe sound for me. Now I find out at 35 years old that I had actually been saying T's wrong my whole life too. Ashley handled the whole ordeal like a champ. She calmed me down and showed compassion and empathy. I know it might seem silly to some people, but it really is a big deal to me, and she got that. You know, I'm not a little kid. I'm a grown woman, and I've built up very intricate constructs within my life to be able to avoid saying certain sounds or sounding foolish. To me, this revelation made me feel more exposed and vulnerable than anything else had up to this point. She decided we should back up a little bit and slow things down. She asked me to make an N sound. No problem. Then she said that since I can make the N sound, it proves that I have the capacity to make the new T sound, since the sound is made at the same place on my alveolar ridge. She suggested that we create some nonsense words, and that would help reinforce my correct N placement, and then that would help also reinforce the new placement of the S, Z, and T sounds. These nonsense words are helping me build technique and, more importantly, build up my self-confidence. Toto zo, nudu zoo, tada sa, needy si. I'm still working on these. They're really, really hard for me. It's very hard for me to say them without pauses. They are very effortful, but slowly they're getting a little bit easier every session. More importantly, these words are giving me hope, and hope is very important because sometimes this just feels too hard. I feel very alone, like I'm trapped, and I'll never be free of my speech impediment or my old way of swallowing. I feel so self-conscious, like people on the street are laughing at me or making fun of me, or in restaurants that people are glaring at me or think I'm gross. I know they probably aren't, but it just feels that way sometimes. I start wondering about whether learning a new way to speak is eroding my identity. I'm 35 years old. I've been talking this way all of my life. Family and dear friends love the way I talk. They say it's part of my charm. If I want to change the way I talk, does it mean I don't love myself? Because that's not true. Also, I have a southern accent. I love it, but it's almost completely absent when I'm practicing words the new way. Also, I'm so slow. I have to talk in a slow robot voice. I'm at a weird juncture now where I'm hyper aware that the way I talk is not the best I'm able to do, but the best I'm able to do occurs at such a slow pace that it is impossible to carry on a normal conversation that way. Typically, I speak very quickly. That's part of my identity too. I'm sure you've noticed that I'm using all old ways of speaking for this voiceover because this would take hours instead of 10 minutes. But then I remember why I started doing this in the first place. It's not just to change my speech sounds. It's because I have a lot more life to live, hopefully, and I want to be able to eat. And if I don't get rid of my tongue thrust pattern, then this is going to continue to be a problem. And I don't want braces forever, and I want to be able to chew my food and bite through sandwiches. If I keep doing this, it'll make my life better, and I just have to keep at it. There's no other option except admitting defeat. And I am not a quitter. I want to be a champion. I have found the best speech therapist ever. I'm in school learning all about speech therapy at PSU. My friends and family are being super supportive. I've shared my story with classmates and the response has been overwhelmingly supportive. I'm not going to be able to change this alone. I need the support of my community and they are absolutely giving it. So I wake up every day and chew my food and use my new swallow to eat breakfast. I keep on practicing my sip slurps. I'm getting less and less water on myself every day.